Thank God. At least now you told me. Yeah. Thank you. Now, so candidates, these are the 10 idioms questions wherein you have to substitute the idioms with the meaning of the choices given. 5 answer choices are given, out of that which is correct. But I may give a clue here. None of the question has the answer E. None of these has the answer. Only 1 to 4 will be the answer. A, B, C, D. Out of these 4, 1 will be the answer. So now we will ask Porkodi. Porkodi, please tell what is the answer choice for number 1. If you want, you can read and then tell me.
Sir, I read, sir.
Tell me.
Always happy to be. Sir, never letting anything her down. Option A, extremely lucky. Option A, someone with a good peers. Option C, care and cheerful. Option A, someone who copes easily. Option this. Option is
Option. What is the option? He is always happy-go-lucky. Always happy-go-lucky.
option.
Option? No, but one thing, I am not able to hear our Parkodi. Valarmati, are you able to hear her?
No, sir.
Oh, acha.
Audio not clear.
Audio not clear. Yeah. What is her name? Parkodi, tell me the answer.
Sir, option A.
Wrong. The answer is C. Carefree and cheerful. She is always carefree and cheerful. Never letting anything get her down. Number 2. Parkodi, read.
They have to pack a bullet and some tough decisions to save the company. Option A, extraordinary effort.
Tell the answer choice only. What is the answer? What is the answer choice? Parkodi.
Yes, sir.
What is the answer choice?
Sir.
Hello, you want to get into Bank of India as a credit officer, and if you fear like this and talk about basic questions on English, how will you ensure success, Parkodi? Tell me quickly, whatever answer you have marked, you tell. Parkodi. Yes, please. I think our internet is not all right. I think so. Ravi Kumar, you tell me.
Sir, Ravi Kumar is also gone.
Acha, Ravi Kumar internet is also not good. Parkodi internet is. Only Valarmati is there. And yeah, Parkodi, tell me.
Sir, screen not visible now. I think some network.
Yeah, some network problem. That doesn't matter. You relax, no issue. Now we will go to Valarmati. Valarmati, tell me.
Yes, sir. Sir, I have to read the question or
Only tell me the answer. Tell me the answer for 2.
For question number 2, B, to face a difficult situation with courage.
Correct. To bite the bullet. The answer is to face a difficult situation with courage. Good, correct answer. Then number 3.
Question number 3, don't count your chickens before they hatch. Answer is A, not to assume something until it actually happens.
Correct. That is not, you should not presume. Don't count your chickens before they hatch. Don't assume. Good. Number 4.
Fourth one, couch potato. The
Hmm.
answer is D. Lazy and inactive person.
Very good. Couch potato means one who is always watching TV, eating something, always sitting and watching TV. Yeah. Number 5.
Sweep the issue under the rug. The answer is B. To hide or ignore a problem.
Good. Excellent. The sweep the issue under the rug. That means you just put the dust below the rug. That is to hide. That is the meaning. Good. Very good. Manpreet, please come to question number 6.
I could not make head or tail of the complicated instructions. And the answer is to let go, B option, to let go of.
No, that is wrong. Can you choose one more
Sir,
option?
I think option, sir.
C.
Huh?
Option C.
No. Manpreet,
To
choose.
A option.
Yeah. To understand or make sense of something. I could not make head or tail. See, when you look at a particular thing, you don't know whether it is the head of that particular animal or the tail of that particular animal. That means you are not clear. Manpreet, question number
Sir.
7. Yeah.
And option C, I think.
Pardon?
So option C, my
No,
answer,
no,
sir. It
no,
seems
no, no.
equal
That's
to
not the. That is not the answer. Because idiom, it is always given. It may not mean the exact meaning of the words. Idioms always contain a different meaning, and this is a very famous one. I could not make head or tail. It is similar to what we say, I could not make my both ends meet. What is the meaning of that? I could not make my both ends meet. For example, Valarmati's husband says, I could not make my both ends meet. What is the meaning of that?
Sir, in Tamil, தலையும் புரியல வாழும் புரியல, like that, sir.
இல்ல சரியா வரல சரியா வரல. I could not make both ends meet.
எனக்கு தொடக்கமும் தெரியல கடைசி.
இல்ல இல்ல, that is wrong. You are telling about this one. I am asking about I could not make both ends meet. The Mrs. Valarmati is spending so much money such that her husband could not make both ends meet. The answer is you are spending more than your income. Make both ends meet means your income is less than your expenditure. Understand? So that's what it is. Here the meaning is to understand or make something. Manpreet, पढ़ लीजिए. Number 7. Manpreet is not there today. No. Manpreet, please read question number 7.
After the long day, yes.
Yeah, are you able to see the screen or not?
Hello.
Yes, please read.
No. Yes. After the long day, I was feeling like a fish out of water at the party. And answer is feeling uncomfortable.
Correct. Correct. The way in which some of us are, while reading these questions and answers, feeling uncomfortable. Correct? Very good. Next, Ravi Kumar. Please read number 8.
he is very competitive and always want to keep up with the Jonas. Sir, option D answer, sir.
Option D is the answer.
D.
Trying to match the lifestyle positions of neighbors or peers. Very good. Correct. Number 9.
He's a straight shooter. You can always trust what he says. I don't know this answer, sir, so I didn't mark it.
Gotcha. कोई बात नहीं. Anybody else has marked Valarmati or Manpreet or Purkodi? Is
I
a
think C.
correct. Correct. Someone you can trust.
You can trust.
Is a straight shooter means you can trust him. Good. Ravi Kumar, number 10.
They hit the nail on the head with their new marketing strategy. Option answer is to come up with something new.
No. To
Can
be,
be said to be exactly right.
yeah, the answer is B. Hit the nail on the head. That means, you know, there is a nail. When you hit it exactly on the head, it will get to go in straight away. So that way, to be exactly right is the answer for this question. So let me repeat the answer. Please check it up. 1 C, 2 Bombay, B for Bombay, 3 A, 4 D for Delhi, 5 Bombay, 6 A, 7 C, 8 D for Delhi, 9 C, 10 is B for Bombay. Is it okay? Good. I'm not
Yes, sir.
going to ask you how many you did correctly and all, but this is just a good exercise for us. Now we will take up the question that is I have given you. What is that? Digital
Digital.
health. Digitally health or digital health, whatever it is. So please start talking on this. Digital health. The first person to come today, Ravi Kumar, second Manpreet, third Valarmati, fourth Parkodi. So in that order, you can talk for, I'm not going to, so okay, time already 7:52. So please talk for 2 minutes, Mr. Ravi Kumar.
Yes, sir. Thank you for giving this opportunity to talk about digital health. Digital health is all about using the technology in digital world, such as wearable technologies, mobile apps, and medical related software that helps patient to analyze them well. And in in digital health, we can also, not we can, actually doctor can also remotely he can access, he can easily track patient's record so that he can give some prescription to the patients. And one more thing is that in digital technology, in digital world, that is telemedicine, where doctor can prescribe through medicine via video conferencing uh, or virtual appointments like that. And one more thing is that here artificial intelligence is also helping to improve digital health. And with the help of analyzing vast amount of patients' record to tell them whether to predict them the diseases of that patient. And one more thing is that uh, previous in 2018, Pradhan Mantri Narendra Modi ji also launched the Digital Health Mission program uh, to achieve individual digital IDs. Actually, this scheme is rolled out in Union Territory right now. That is Chandigarh, Daman, Diu, Puducherry, whatever the Union territories. These schemes already rolled out. That's it, sir.
Manpreet. Manpreet.
My name is Manpreet.
Yeah.
My name is Manpreet Kaur. I'm from Gurdaspur, Punjab. I have done MBA in Finance and Marketing. So thanks for giving me the opportunity to discuss the topic digital health. Digital health means use of digital health technologies and electronic devices healthcare healthcare delivery and patient outcomes. Digital health technologies includes various applications like mobile health application, electronic health records, telemedicine, and remote patient records, etc. Digital health has aims to enhance the communication and communication, data sharing, and decision making between the healthcare providers and patients. There are various benefits of digital health technologies. Telemedicine and mobile health apps are very beneficial for those people who are living in the rural and remote areas, because they sometimes they are not able to go to hospitals because they are far away from their areas. With the help of these apps, telemedicine and mobile health apps, they can communicate with the doctors, and they can consult with the specialist doctors, and get information about their health. And second is effective disease prevention. So digital health technology are helpful to prevent from the disease, because they can early detect the disease, to monitor and detect us continuously. Because there are various apps to because there are various apps are very helpful for keeping us healthy. For example, Healthify Me. There are very popular apps in India. Many people are following this app, because in this app, experts are available 24 into 7 hours. So they guide people what to eat, and at what time they can eat. So it is very helpful to people get healthy. And now there are also various smartphones. There is already installed the health application app. When people can go for a walk, and go for a running and jogging, these apps continuously counting their steps, and in this way people can get information about the health, and they can also know what how many calories they consume and how many calories they are burnt today. So in this way they can get good information about their health. And this and the last is it is also helpful for the healthcare providers to communicate with each other and share the information uh, of the patient. And the government of India also launched the app application, that is Abha, Ayushman Bharat Digital Mission. It is launched in 2020, and its main aim is to provide this single platform for all the healthcare stakeholders, to exchange and share information, share health related information with each other. And second is E-Sanjeevani Yojana. It is also government initiative, and it is launched in 2018, and its aim is to provide free teleconsultation to those people who are living in remote and rural areas. But digital health also faces also some challenges. First is the digital literacy. Both healthcare provider mm, uh, and patients are not adopt digital technology, because they are not familiar with these technologies. And second reason is data privacy and securities. Both healthcare provider and patients, sometimes they cannot adopt these technology, because they don't want to share and exchange information online. This is the reason they are not adopting the technologies. Thank
Okay.
you, sir.
Okay. Valarmati.
Yes, sir. Good evening, everybody. I am Baladmati. I am from Tamil Nadu. Thanks for giving me the opportunity to discuss about the topic digital health. Health for lead a good, better life. Health is very important. So the new modern technology of health is digital health, and digital health uses digital tools and platforms to improve healthcare outcomes. Uh, so, uh, digital health is accessible in each and every place of the world, and in our country like India, uh, our physical medical facilities are available in only cities, and in villages not much that when compared to cities, and only 23 percentage of populations are accessible to those medical facilities, and a remaining 75 percentage of people cannot get the health facilities with affordable cost, and whenever they needed, whenever they needed. So digital health helps a lot of people to get their healthcare facilities with affordable cost, because using a digital health like telemedicine, we can access that consultation with a doctor anywhere, and the cost is also very low, and we can get our medicines without dose also. A lot of digital apps for getting medicines also available, and at the same time, we don't know how we are eating, it is how much calories we are eating, it is good or not, like that confusions and all, most of them in the country are having. So some apps are there, we can able to calculate the calories levels, and
Hello. I think Valarmati internet has gone probably. Ravi Kumar, you are able to hear her? Speak,
sir,
No,
I
sir. No,
can
sir.
able to hear your voice.
but your voice is not heard. Yeah, that is the problem. Now yeah, you have some more points to add?
Yes, sir.
Yeah, please add quickly.
So people in remote areas can easily get the facilities of telemedicine, and some and other facilities of digital health.
Hmm.
Digital health also.
Oh,
So the
பொண்ணு பட
achievements of tremendous Ayushman.
your daughter is troubling you.
Yes, sir.
No problem. We will go to Porkodi. Porkodi, please come. Porkodi,
Sir,
Porkodi, speak. Confidently speak.
sir,
Porkodi,
I'm
speak.
audible, sir.
Yeah, now you are audible. Yeah.
Sir, okay. Good evening, sir. Good evening, and good evening, Tamil Nadu. Thank you for giving this opportunity for the about digital health.
Acha,
Uh,
Porkodi,
the
Porkodi,
club,
Porkodi,
sir.
Porkodi. What is the connection you are having? Airtel or Geo?
Yes, sir.
Which one?
Airtel, sir.
In your place, there is no Geo?
Airtel, sir.
No. Do you have Geo or not
No,
in your
sir.
place? Do you have BSNL? BSNL is
No,
no good.
sir.
Huh? BSNL must be good now
Yes,
because
sir.
you are in a village. BSNL must be able to give a good service. I suggest if you have a 2 SIM smartphone, in the other SIM, you try to buy 1 month for 1 month that BSNL and use that, or try to use BSNL phone of your friend or somebody for one day logging in to check up whether how it is working. Because totally
Yes, sir.
useless whatever you are speaking, nothing comes here. And if this is
Oh
going
my
to be the
God.
case, you'll have a lot of problem in following our Bank of India classes also, because you must have good connection. I don't know whether it is a problem at my end. Let me check it up. because all others are also not able to hear you, you know. So when that be the case, I think it must be the problem at your end only. So for me, here the speed is good, nearly 88 Mbps speed is there. No problem. So I don't know. Please speak. You complete your discussion today. Let us see what happens. But it
Yes,
is
sir.
easy for me to say everything, but difficult for you to go out and get. You have to give your Aadhaar and then buy one more BSNL. Getting connection may take 2 or 3 days. I don't know. Please, in places like Tamil Nadu, Kerala, and all, BSNL connection is far better than the other connections. That's what I have heard. So, Perkodi, please speak in English.
Yes, sir. I am Parkade. I am from Tamil Nadu. Health is wealth. We know the proverb. Good health is most important in human life. Nowadays, we are using technologies in various fields. So, digital health is one designed. Digital health is a broad and multidisciplinary platform. Digital health is a concept from a relation between healthcare and technologies. Using digital, we get information about our health through smartphones, wearable devices. It is improve the quality of healthcare, and using digital health, people can manage their health more effectively. Telemedicine and mobile health apps, they are play a major role in digital health. Provide remote consultants, providing health information also. It is mostly used in remote area people. And yeah, it is the next level of digital health is the next level of healthcare improvement.
Mm. Yeah, I think again our internet has gone. Doesn't matter. Good. Now what we will do, we will go. I think you must have read our, what is that? Yeah. You must have read already. You must have read our, say, group discussions ideas.com. Group discussion ideas.com. So I will take you to some other areas we can read. Yeah, google.com, the India digital health plus and minus. Yeah, now I am showing this to you. Yeah, whose internet is good? Valarmati's internet is good. Valarmati, please go
Yes.
through this. What are the negative except
What are the negative
negative?
except of
No, it is
healthcare
wrong.
in
It
India?
is wrong. Negative aspects.
Okay, sir. What are the negative aspects of healthcare in India? The negative aspects of healthcare in India are rural people face the crisis of doctors because most doctors settle in urban areas. They have to travel long distances to reach a doctor. Uh, B, B, B. About
No,
live
yeah,
A point A point B.
and maybe that B extra B has come. Doesn't matter. About 5
About live lakh people die from tuberculosis every year.
about
5 lakh
5 lakh people.
people
Yeah.
die from tuberculosis every year. Almost 2 million cases of malaria are reported every year.
Okay. Continue.
What are the benefits of digital health in India? One of the biggest benefits of digital healthcare is telemedicine. With its mass adoption during the pandemic, patients in rural and remote areas who remained aloof from healthcare services can now access affordable and quality healthcare.
Good. Continue.
What are the problems with healthcare in India? The Indian healthcare system is faced with several challenges, including increased healthcare costs, need for nursing and long term care for senior citizens due to the rise of the nuclear family system, high financial burden on the poor, increasing burden of new diseases, and negligence of public health functions.
Yeah.
Which country has best digital health system? Estonia.
Oh, Estonia. Rank one.
Second, Canada.
Second, Canada. Third, Denmark.
Denmark.
Fourth is Israel. Very good. Very good. But even here we find it difficult. Continue. What is the
biggest health problem in India? There are many leading diseases in India. India has one of the highest numbers of patients in the world suffering from critical illnesses such as cancer, diabetes, and heart disease, to name a few.
Very good. Next, Manpreet ji. Manpreet ji, please come.
Yes, sir.
Please read.
Why is healthcare so poor in India? The Indian government continues to underfund the healthcare sector as it spends roughly 1% of GDP on health. This percentage is among the lowest for any major economy. The scarcity of government funding to support the healthcare sector often drives Indian citizens to use savings and out-of-pocket money to cover.
I think this position is being rectified. The present position is, anybody knows? I think nearly 2% of GDP is spent by Indian government. Let me just check it up. Google.com. India percentage of GDP spent by government on medical field. Sorry, I typed field. Yeah, it is now 2.1%. Please read this, Manpreet.
In keeping with this objective, central and state governments' budgeted expenditure on the health sector reached 2.1% of GDP in financial year 23 and 2.2% in financial year 2022, against 1.6% in financial year 21.
So that means we are improving. So you read this also. This is what we have read now. That is over.
Yes.
Then how much is India spending on healthcare? Please read.
How much is India spending on healthcare? The total estimated expenditure on healthcare increased from rupees 97.9 billion in March 2021 to rupees 104.5 billion in April 2021, with expenditure on medicines, doctor fees, hospital charges, and medical tests driving this increase.
Of course, this information is not directly related to the topic we are discussing. Doesn't matter. Good. I think we have covered almost all the important points. This one only. What is the difference between health informatics and digital health? What are the... I think these questions are very interesting. Please read. What are the main benefits of digital health technologies?
Sir,
Are you not seeing?
showing.
Screen not showing.
No, sir.
Sorry. Yes. Please read. Which of the following are the benefits of digital healthcare solutions? Please read quickly.
What are the main benefits of digital health technologies? Sustainable and responsive healthcare, prevention before treatment, remodeling of patient-doctor relationship, expanding the reach of healthcare professionals, reduces inefficiencies, improve access, reduce costs, increase quality.
More items. Increase qualities. So I am giving this one some digital health. One link is coming. I am giving it in our what is that? Spoken English. I am giving it here so that you can read it afterwards. Okay. Good. So that is over. What are the main? So this one over. Now, what are the difference between health informatics and digital health? Please read.
Clinical informatics.
Continue.
Clinical informatics is the application of health informatics knowledge is in the clinical setting to promote quality care. Digital health is the use of information technology and electronic communication tools, services, and processes to deliver healthcare services and facilitate better health.
Good, continue.
What are the examples of major challenges we face in the med tech sector? Scale, biomedical complexity, personalized and bespoke medicine, early diagnostic, precision and robotic surgery, rehabilitation and assisted devices, stem cells for regeneration and therapy, the regulatory environment and standardization.
Good, that is okay. What is the effect of technology in medical sector? Read this also.
Technology has made a huge impact on the healthcare industry, from smoothing out internal processes to enabling surgeries that are performed remotely by robots. It's crystal clear that technology comes in handy. Patients no longer need to wait in lines as they can book a medical appointment using an app.
Super, super. I think this much will do. We have studied sufficiently well. Now, tomorrow's topic we will take what is the topic? I think artificial intelligence we have studied, but still growth of service sector. This also we have discussed. Then reusable launch vehicles and all beyond our this thing. Effect of chat GPT on journalism. Effect of chat GPT on journalism. Okay, so that is the topic for tomorrow. Effect of chat GPT on journalism. I am giving the topic here in our spoken English group. 1 minute. Yeah, very good. Please, it is there in our group discussion. Apart from that, I suggest you search other areas also, as I am doing, and try to get some points so that you can speak well. But all of you are speaking well. Only problem is our internet is giving trouble for us, over which we have no control. 2023-05 PM class topic. Okay, thank you. Anything else you would like to speak? Valarmati,
Yes, sir.
anything? Yeah, anything question? 7 o'clock we will meet for Bank of India. I think I have asked you to discuss the topic we have discussed here, namely loans and advances in Bank of India. Okay. Today, I have given that topic, loans and advances in Bank of India schemes. So I would request you to take about 2 or 3 schemes and speak about them. That is, what are the various features of that scheme? I would like you to speak so that when they ask in a credit officer interview about the loan facilities of Bank of India, you must be able to speak with confidence. Okay. Thank you. Thank you so much.
Thank you, sir.
Any questions? Yeah, Valarmati, we'll meet tomorrow at 5 o'clock as usual.
Okay, sir.
Thank you.
sir.
Thank you. Bye.